Once WHO, in the person of Sir Liam Donaldson, had identified Kevin's patient journey as a learning tool, the way forward then became very clear to use that story as a catalyst for change by raising awareness, stimulating change with the goal of healthcare improvement, but most importantly, preventing recurrence. So that was really how it all kind of came about. And then that has been happening at very many different levels of healthcare. Say, for example, organisational, education, and my collaboration and partnership really spans the international, national and local arenas, and it covers a really wide variety of areas, say speaking engagements, policy, regulatory, research, education. So it's quite a broad spectrum. I suppose where it's really motivating change is in the area of education. I go to, and that's really where my heart is, I go to speak to students in the universities all over Ireland here, and because I feel very strongly that this is the new cohort, these are the new professionals, and it's a very effective way of bringing about sustainable culture change. And I get some extraordinary feedback from these young students, you know, and that feedback is really valuable because it lets you know that you are impacting, not alone on healthcare in the here and now, but you're impacting on it into the future. You're helping to form the hearts and minds of these young people. Yes, I have spoken to students in that particular hospital. I have spoken to a whole range of healthcare professionals in the health service executive, which is the overarching body for delivery of healthcare in this country. So when I go to conferences, I'm speaking to the people who are actually working at the front line. I'm speaking to clinicians. I'm speaking to the policymakers within those organisations. So yeah, without a doubt, Kevin is actually embedded in not alone in the Irish healthcare system, but in many other countries as well. Well, I think first of all, the storyteller has to be the right person. The storyteller has to be the patient or a family member, someone who accepts that you can't change the past, but who really is passionate about using that past to inform the present and then using the present to influence the future. So the storyteller motivation and the genuineness of the storyteller are really paramount, because that storyteller is really honouring the individual experience while also asking healthcare to give meaning to tragedy by preventing recurrence. And I suppose the key elements, well, the story has to really have shape, structure and purpose. And the purpose is really all about motivation to effect change. And the story has to be told in a way that engages the audience and helps them to identify with the patient, family and with the healthcare provider, because they too are affected by these events. And it's really important for the audience to get to know the patient, to make a connection with him, not as a statistic, not as a medical condition, but as a real person. The chronology forms the basis, but then there are key messages I want to bring home, and it's really very important that those key messages are reinforced as you tell the story. I described the interactions of it with the different doctors and identified the shortcomings. I described the inappropriate responses and the interactions, and then I describe a better way as demonstrated by Sir Liam Donaldson, because he really listened, he really heard, and he didn't offer excuses. And I explain how staffs were also affected by Kevin's step, and I explain what patients want in relation to disclosure and to match it to advice from, say, IHA. Because it's important, telling the story can be very cathartic, but it has to be more than that. It's a learning tool It's a learning tool. And I identify the lessons to be learned, and I give my wish list around the things I would have liked to have been different and what I'd like to see changed in the future. And I try to make it real. It's very important to make it real, and I do that through the use of photographs, and I make it relevant to clinicians by, say, using some data, laboratory test results, evidence of deterioration, peer review, all those kind of things, and I give examples of feedback, because if you like, feedback lends credibility to the whole exercise, and it shows that others have valued the story. And then, most importantly, I think it's really good to finish with a strong message. And the strong message I like to give is that which I first heard from Sir Liam Donaldson, which was, to err is human, to cover up is unforgivable, but to refuse to learn is inequitable, the whole thing.